Welcome to the Icelandic Roots webinar. Uh, we're following up on our series of 150 years of the Icelandic settlements at Gimli and also um, in Minnesota, in Minneota. And today we have a very special guest, Ryan Eyford. He's a professor at University of Winnipeg in the Department of History. He's done a lot of research on the Icelandic settlement, and he's written a book, White Settler Reserve, which has gotten a lot of press and is a popular book for understanding the settlement. And he's going to talk today about the smallpox epidemic that plagued the settlement in 1876 and 1877. And just before we begin, let me just give a little bit of a background. So in 1875, there were about 235 Icelanders who traveled north by flatboat on the Red River from Winnipeg to the west shore of Lake Winnipeg. And they'd been promised an Icelandic reserve in what was at that time an unorganized part of the Northwest Territories. The reserve was established by an ordering council, which is a monarchic part of the Canadian government. And at that time, for a very short period of time, the governor, I'm forgetting the proper name, the governor general. I'm American, so I don't know all the little minutia of Canadian governmental history. Government general presided over the ordering council. And that the governor general at that time was Lord Dufferin, who had visited Iceland as a child, was fond of Iceland and the Icelandic people. And it may be that he helped influence the ordering council decision to form this community. 1,200 others joined the first group in 1876. Some had remained in Winnipeg the first year. There were additional people who showed up soon after that. And the settlement created its own laws, maintained their own schools, managed their own affairs in what was kind of a unique chapter in Canadian history. But a series of disasters, including the floods and the smallpox epidemic, which lasted between 1876 and 1877, really decimated the population and also scattered them around. Many people left the area and then would return. We think of Gimli today as the Icelandic center of Canada, but imagine everyone leaving and going elsewhere and very few people staying and then coming back. So we're really happy to have Ryan here, and I'm going to let him give his presentation. We'll be able to ask him questions, and it should be really fantastic. So thank you, Ryan, for joining us.
All right, thank you, Jason, for that kind introduction and for the invitation to speak to all of you today. Thanks to everybody who's tuned in, which I see includes my mom. Hello, Mom. How are you doing? We'll see you soon. I've got some slides to show you, so I will turn those on. Can everybody see that? It's working properly? Doug, it's
yeah, we can see
everything's
it.
fine. Yeah, okay. So preparing for this presentation took me back to research that I did 20 years ago when I was a first-year PhD student at the University of Manitoba. And at that time, I knew that I wanted to write a history of New Iceland that was new, that used sources that hadn't been available to people who had written about it before. As I thought I knew there were sources that hadn't been fully tapped. And I also wanted to know how New Iceland fit into the bigger story of the history of Western Canada. And those were my two big goals, to sort of put New Iceland in context. Say, why did this happen? Why was it that there were Icelanders settled in the middle of North America in 1875 when it was a very hard place to get to. Involved a very lengthy journey of many stages to get from Iceland to the west shore of Lake Winnipeg. So to do this, I focused on unpublished archival sources from Library and Archives Canada, which is our national archives here in Canada, located in Ottawa and Gatineau, as well as smaller archival collections in Canada, in the UK, and in Iceland. This is one of the things I found here on this title slide. It is a detail from a map that I'll show you in a few minutes of mapping out the terrain of the epidemic. You'll see up near the top, it says White Mud Icelandic or White Mud River. It was originally called the White Mud River, but the Icelanders renamed it. And that's what it's known by today. And you can see the notation underneath the river says disease first showed here. That was where the outbreak of smallpox began. And down lower on the map, you can see Gimli is marked off. It's that black section, and there's a hospital there, which was the smallpox hospital. So I'll tell you about that story today. This is drawn from the book that Jason mentioned. This is the cover of this book is a photo from the Hudson's Bay Company archives. And it was colorized by UBC Press, but the boat in the picture is the steamship that towed the first group of Icelanders to Willow Point on October 21st, 1875. This particular photo was taken at Norway House further north in 1880. But I included it because it's got the picture of the Colville in it. This book has Jason mentioned it. It's been well received. People have had a lot of nice things to say about it. It's been out for almost 10 years now, and probably a lot of you know, academic books don't tend to sell many copies. This one is definitely not anywhere near the New York Times bestseller list, but it has some kind of unique features to its sales record. And one is that 20% of the books that have been sold were sold at Turgeson's store in Gimli. So when it first came out, Lorna Turgeson asked the press for 200 copies, and they were sort of taken aback. But Lorna has sold all of them, which, is reflects the fact that people are interested to know this history and to read about what I was able to find by looking in the archives. So I'm going to tell you about one of the stories that's in the book, one of the chapters, the terrible smallpox epidemic that swept through the colony in the fall and winter of 1876-77. This was actually the first portion that I wrote starting back in 2005. And I picked it because it was such a major event in the colony's history, and it occurred so soon after the establishment of the settlement. In Icelandic River Saga, Nelson Gerard said that the epidemic was, quote, a severe trial of death, sorrow, and disillusionment, and one that tested the mettle of even the stoutest hearts. It was certainly that, not only for the Icelanders, but also for the indigenous people that lived within what became New Iceland, or the Icelandic Reserve. My chapter explains how the epidemic reshaped the entire region, displacing the indigenous population who had called the area home long before the Icelanders arrived in 1875. I got something exciting to show you here, which was this is gonna, might not be as immediately exciting, but it's a map from 1812, and this is, I think, the oldest map that shows the southwest shore of Lake Winnipeg in any detail. If you can see my cursor here, down here is the Red River, and this is the south basin of Lake Winnipeg. And this is the island that today is called Hekla, but the Icelanders called Mikle, Big Island. Here it's called Buff Island, like Beef Island. And here's the White Mud River. Here's Drunken River and where Arness is today. And here is Willow Point, which here is called Presqu'île. This was made by the Canadian fur trader George Nelson in 1812. There's also an X here at Sandy Bar showing the location of a fur trade post run by a Mr. Crabassa, who worked for one of the Montreal-based fur trading companies. So this shows the what was going on, some 60 years plus before the Icelanders arrived. Interestingly, if you know the famous Canadian doctor Norman Bethune, one of his ancestors was a fur trader who worked at that post, Mr. Crabassa's post, earlier in 1805, 1806. So there's a lot of records that document what was going on in this region before, but and we can trace it back through this fur trade history and trace back the lives of the Cree and Anishinaabe people who were living there long before New Iceland was established. The New Iceland was created, as Jason mentioned, in 1875 by an order in council. And here you see it's outlined here on the west shore of Lake Winnipeg. To the Canadian government, it was called the Icelandic Reserve, and it was part of a larger policy of creating reserves for immigrants that, with the idea that they would attract further immigration, that once a group of people were settled in these places, that their friends and families and neighbors would follow them and settle in that place as well. And this was done with the Mennonites in southern Manitoba. A year before the Icelanders, the Mennonite East Reserve was created, and the Icelandic Reserve was created in 1875. This actually, they borrowed the idea from the land grant policies of the railroads in the U.S. That's where this idea originally came from. But it was imported to help speed up the immigration into Western Canada in an attempt to try to change the demographic balance from predominantly indigenous, as it was in 1870, to predominantly European origin. That was the objective. You can see on this map too, it also shows lands reserved for indigenous peoples, including Indian reserves south at St. Peter's, Fort Alexander, Broken Head, Fisher River, in the vicinity of New Iceland. Probably most of you have seen this painting before. This is depicts the first contingent of settlers arriving at Willow Point in October 21st, 1875. These were mostly families with young children who had emigrated in 1873 and 1874, settled mostly in Ontario. Some came from Wisconsin. Sometimes we see pictures of these people, but they were taken much later. So they look like they're older, but when this actually happened, they were, in their 30s or early 40s, and they had a lot of young children with them. And there were, I think, something like 8 or 9 women were in their 3rd trimester of pregnancy when they arrived at this time. So there were a lot of babies born shortly after arrival. There's no contemporary images of this event. This was created in 1950 to commemorate the 75th anniversary of New Iceland by Árni Sigurðsson, a Icelandic Canadian artist. And so this has now become a very iconic image of New Iceland. And the original is in the collection of the New Iceland Heritage Museum. And if any of you are coming to Gimli for the convention this weekend, you'll be able to see this painting on display in the museum, especially put on display for the 150th anniversary. So this first group spent a very difficult winter in the vicinity of the new village of Gimli. They were malnourished, and many developed scurvy as a result. There were at least 7 deaths during that first winter, but likely many more. The 7 deaths were of adults in the group, but they survived the winter. And in the summer of 1876, the Icelanders spread out from Gimli to claim lands in other portions of the reserve, including the White Mud River area, where there was an indigenous settlement. So here's art from a later period. This is more recent art. This is from a graphic novel published in 2014 that shows the confrontation between John Ramsey, who's an Anishinaabe man who lived, or Ojibwe is also another name for the Anishinaabe, used in the U.S. context, and Oliver Olafsson frá Espehot, who's the guy who gave Gimli its name in 1875. So this dialogue is not, we don't actually have the dialogue of their discussion, but the issue was who had rights to the land along the White Mud or Icelandic River. And Ramsey and Oliver claimed the same location that Oliver called Os or estuary. Ultimately, some sort of agreement was worked out between them, and in the first summer of 1876, the Icelanders and the indigenous people lived side by side in that area around the river and at Sandy Bar. So while the first New Iceland settlers were trying to get established, Sigtryggur Jónsson, who was one of the people who had picked the colony on Lake Winnipeg, sent out as a delegation by the Canadian government. He was in Iceland recruiting as an immigration agent for Canada. And along with another agent, he organized a contingent of more than 1,200 immigrants that became known as the Large Group. They arrived in New Iceland in three parties between August 20th and September 20th, 1876. And it was these people who unwittingly introduced smallpox into the area. So in case you're not familiar, I'm going to tell you a bit about smallpox. I'm going to show you a picture of a smallpox victim. I've picked one that's not as graphic as some of the other pictures that are available to show the effects of the disease, but this is a photograph from the 1880s of a person with smallpox. It's caused by the variola virus, which is airborne and highly contagious, has an incubation period of 10 to 12 days, during which time the infected person can be asymptomatic. The virus can also be transmitted by bedding or clothes. It can survive outside the human host as well. And the distinctive pustules shown in the photo is what people really know about smallpox, and it can cause blindness and disfigure people quite severely. This was the disease. Both Iceland and Western North America experienced catastrophic smallpox epidemics during the 18th century. In 1707-09, the disease killed 26% of Iceland's population. A shocking number of people died in that epidemic. And there was within the same few years, there was an epidemic in North America. But the really big one was in 1779 to 1783, which spread from Mexico north all the way to Hudson Bay and to the Pacific Northwest. And this map from Paul Hackett's book, A Very Remarkable Sickness, shows the path of that smallpox. It's usually called pandemic from that period. There was a periodic epidemics of smallpox in the 18th century, but this declined both in North America and in Iceland after 1800 with the introduction of vaccination. The original vaccination was created for smallpox. It was using a related virus, cowpox virus, which gave people immunity against smallpox. That was the original vaccine. And the first vaccination campaigns in what's now Manitoba were undertaken by the Hudson's Bay Company in 1820. And they wanted to protect their suppliers and customers was the reason from the disease. And the Hudson's Bay Company did periodically vaccinate while it was in theory, the governmental organization in northwestern North America. In Iceland, vaccination became routine in the 19th century and became common and usually when people were confirmed in the church, their vaccination status was also recorded. Probably some of you have seen that on church records from Iceland, saying is some so and so vaccinated? Do they have? Some of you have probably seen the Bola attest, like the attestation that they have been vaccinated. Um, so by 1877, though, Sigtryggur Jónsson asserted that local authorities in Iceland were not always scrupulous in carrying out their duty to vaccinate, and he observed that those settlers who had been vaccinated within the previous 5 to 7 years did not contract the disease during the epidemic in New Iceland. So there seems to be some sort of a bit of a different outcomes among the different people in New Iceland based on whether they had been vaccinated at all is the biggest one, but how recently they had been vaccinated. I'll say more about this a bit later. One of the big questions about the epidemic is how did it actually get to the Icelandic reserve? Well, when passengers arrived at the port of Quebec, this is a photograph of the port of Quebec from the 1880s or 90s. It was Canadian immigration officials inspected the health of the immigrants. If someone was sick with a communicable disease, they were sent to Grosil, which was the quarantine station of the port of Quebec. The reports when the Icelanders of the large group arrived, no one was sent to Grosil, no one was sent to hospital in Quebec. They said that the health was good. That was the report, and that nobody was left behind. And that's actually not true. I found that there were people left behind. Uh, there were two families who stayed in Quebec and didn't go forward with the group because the couple, the wife was about to give birth to a child. So this is one of the two couples. Sorry, it's a terrible scan, but Margaret Magnusdóttir was 41 years old at the time, and she was 9 months pregnant when they arrived at Quebec, and the on the 23rd of July 1876, she gave birth to a baby girl named Sigríður Rosa. Um, the other couple that stayed with them, Halldór Jónsson and his wife Ingibjörg Jónsdóttir. Ingibjörg gave birth to a son named Jón on July 24th. So these families they stayed behind their group, but then they came west with the second group and arrived in Winnipeg in the latter part of August. And I know this because the Reverend Paul Thorlickson christened the two children that had been born in Quebec in Winnipeg on August 18th. So they had all made it that far, definitely by August 18th. So the large group settlers, they made their way from Quebec across North America and to Gimli, a journey that took in a lot of cases a month. John Taylor was the Canadian government agent responsible for New Iceland. And in a letter dated September 22nd, he said that a boy, 8 or 10 years of age, who had been left behind by the first party at Quebec in the hospital, this boy is just recovering from the smallpox. This is the first mention of smallpox in the history of New Iceland, is this letter from John Taylor. And he asked at the same time that a quantity of vaccine could be sent so that all the children could be vaccinated before winter. It took letters about a month to travel between Gimli and Ottawa, so it's very unlikely that this would have been able to. This could have happened, but it didn't happen in the end. That the vaccine was not sent and the children were not vaccinated as Taylor had recommended. The statement from Taylor is consistent with what Sigtryggur Jónsson later said. When I arrived, it was asserted that the disease had been introduced by a boy belonging to the first party who was left behind at Point Levy with his family, but being taken sick there, during their stay at the immigration sheds, was brought to a hospital and sent out on with the last party, and arrived in Winnipeg on the 10th of September with pockmarks on his face and hands. So the two couples that stayed behind, one of them had a son who was 8 to 10 years old. So it's possible that that this was the boy that arrived with pockmarks on his face and on his hands. Um, and if it was the case, then it was likely that he spread the disease to his own family because five of his siblings tragically died in the epidemic, and they were among the earliest victims. But it's not entirely certain that that's what happened. One of the settlers, Thorgrimur Jonsson, he said that the disease came on some clothing that one of the settlers bought at Quebec, and that spread from there. That is also technically possible because the virus can survive outside the body. So we don't have conclusive, we can't be epidemiologists in history and quite figure this out. We have some ideas, but we don't know for certain. Thorgrimur Jonsson dated the beginning of the epidemic to September 24th, 1876. Our absolutely best eyewitness account was one of the sources that I found in my research, which was the journal kept by the Reverend James Settee, who was of Cree and English ancestry from the Hudson Bay region. And he was a missionary for the Church Missionary Society. And he presided over a divine service at Sandy Bar that was attended by both Icelanders and Indigenous people. And when he was after that service, his wife said to him, "We need to get out of here. There's smallpox here." And you see this quote here where he says, "I said that was not possible," but she affirmed and wished to put the canoe in the water. His wife had seen smallpox before, whereas he hadn't. And he said in another one of his writings said it would have been 150 years since they had seen smallpox because of the effects of vaccination, reducing the size of epidemics. But she wasn't listened to except by one man and his family who left and went across the river, or run across the lake, pardon me, and likely spread the disease to the east side of Lake Winnipeg as well, because there were people that died there. So this is the beginning of the epidemic, as recorded by the Reverend James Settee. And one of the things he wrote was that poor Benjamin Cameron's daughter was the first one to die of the disease. And probably some of you have heard the story of the grave of Betsy Ramsay before. It's a very famous story about New Iceland. But Benjamin Cameron's daughter was Betsy Ramsay, the wife of John Ramsay, who I mentioned earlier. And this was a marble headstone that John Ramsay had erected for her later in the 1880s. And you can see it says died of September 1876, aged 35 years. So she was one of the first, but her parents, who were also lived at Sandy Bar, also died. And her three sons, three young sons, died. Only one daughter, named Mary, survived, along with her husband, John Ramsay. In general, the Indigenous people that lived by in the area, the government doctor who was sent by the Department of Indian Affairs said that their numbers had been reduced from 50 or 60 to only 17 in the end. This is one of those doctors, Dr. James Spencer Lynch. This was a joint statement from him and David Young, another physician from St. Peter's settlement. He says, the disease here is smallpox of a mild variety, varioid, but very fatal owing to unfavorable circumstances and bad food and want of ventilation. About 20 persons had died in this immediate neighborhood within the past 10 days. It is reported that only 2 Indians are left living at Sandy Bar out of 20. And this was sent on November 1876. So based on this report, there was uh, a public health response from the Lieutenant Governor of Manitoba and the Canadian government. Um, the Lieutenant Governor moved to quarantine the whole region by putting up what's called cordon sanitaire, which is a line that people cannot cross if they're in the what was called the infected district. The government of Canada was wanted to decline, one didn't want to do this. This was a coded message from the Prime Minister of the day, Alexander Mackenzie, said people themselves must avoid contagion, decline expenditure for that quarantine. Um, the Lieutenant Governor of Manitoba responded, yours of yesterday requires reconsideration. If action not taken, loss of life among the Indians and others of the territories will be great. You authorized the quarantine. And Mackenzie had earlier authorized it. And then he was trying to backtrack and say, no, no, don't do that. But the Lieutenant Governor went ahead and created the quarantine and established a board of health for Keewatin. This was a proclamation from the Lieutenant Governor proclaiming the quarantine, saying that the disease had broken out, and it says do hereby warn the Indians in the locality in question and the Icelanders from coming into our province or holding any communication with the people thereof, except through persons authorized by us for that purpose. And at the top, you can see that the quarantine was in place from November 24th until July of 1876 to July 21st of 1877, long after the disease had run its course within the settlement. These are just this is the makeup of the Keewatin Board of Health, and interestingly, it's a military. There's military representation on it. It's headed by Lieutenant Colonel Osborne Smith, who was the commander of Military District 10, who was the senior military officer in Fort Garry at the time, and included representatives from Immigration Department, the Indian Department, and two medical doctors, one of whom had formerly been in the military. Sometimes when you're doing research, you find things that nobody had ever seen before or hadn't seen in a long time, and this was one of them. This is the full version of that map I showed you at the beginning. But this is when I first saw it. It was on a microfilm, and I thought, well, there must be a color version of this. Like it must, or the original must still exist. And eventually, I was able to track down the original of the map, which is good because it shows the different colors, which have different meanings on here with the red and the blue. So this is the manuscript version from Library and Archives Canada, the quarantine map of Manitoba and Keewatin. In the book, I have a redrawn version. I got a cartographer to redraw this map to make it a little more clear, to show what's on it. So this is the cartographer's drawing. So the red line is the Keewatin line of demarcation. That's where the quarantine was supposed to be at Boundary Creek, which is now in Winnipeg Beach. The Manitoba line of demarcation was where the province of Manitoba had its quarantine line. So it was a bit south of the Keewatin line. And you could see here where it says quarantine grounds and troops. And on the inside here is hospital. There was a hospital at Netley Creek, hospital at Gimli, and there was a guard and then a military detachment at the quarantine station. If people wanted to pass south, they had to get through that quarantine station. They had to stay for a certain amount of time, and their clothing was destroyed before they could proceed. And that was in place until July. The surrounding Indian reserves, the local population there enforced their own quarantine to protect their population against the infection. And the Department of Indian Affairs sent doctors to vaccinate people in those locations to try to isolate and contain the outbreak to within the Icelandic reserve. because by the time the government intervened, the epidemic was already fully underway. They couldn't really stop it within the Icelandic Reserve. They could only try to prevent it from spreading outside, south to Manitoba or north to the other indigenous communities further north. So that was the focus of the government's efforts. And it ended up generating a huge amount of archival material because the controversy over this quarantine and all the expenditures related to it lasted for years and years. And that was one of the places where I found the map was in one of the files on all the expenditures for this quarantine, which uh, the prime minister and the government of the day were argued with Morris about. And eventually they took Morris, they removed Morris from his position because they were political on opposite sides of the political divide. Government was liberal, Morris was a conservative. They didn't approve of his actions in this instance. One of the things that happened during the quarantine is that the Icelanders organized themselves into boards of health in each of the settlements within New Iceland and undertook a thorough disinfection of their homes and their properties. There was a bit of a distinction made between the property of the settlers and the property of the indigenous people, and that John Ramsay's house was burned, for example, whereas some of the other houses were not burned, but they were just disinfected. So that was part of the end of the epidemic, was undertaking this significant disinfection effort, which included burning property and also cleaning it. And this is a certificate that was issued to Thorgrimur Jonsson, who I mentioned earlier, saying he's been free from the smallpox during the past month and that his house and clothing have been thoroughly disinfected, and it's quite safe to pass him through quarantine. And it's signed by Dr. Badome, who was one of the doctors sent by the Board of Health, and this is from June of 1877. Another one of the sources that I found of the epidemic was this list of those who had died, and this was compiled by Sigtryggur Jónasson and submitted to the Canadian government. And it was Thorgrimur Jonsson's own son, Thorgrimur, who was 2 years old, who's the first person listed on this list at the top, and then it includes everybody who Sigtryggur knew had died up until February of 1877. And this is a really important source for for genealogical purposes to understand what happened to some of the first Icelandic settlers. And it really is if you look at the numbers, you look at the names and the ages, it paints a picture. One of the there's 102 deaths in total, but only 25 out of those 102 were over 12 years of age. Most of them were very young, most like Thorgrimur, or were babies, infants, young children, children who had been born in North America and had not been vaccinated in Iceland, or children who had emigrated from Iceland before they had been vaccinated. Those were among the people who were most likely to die of the disease in 1876 and 1877. Nobody has yet done a really thorough analysis of this. It would be possible to trace people back to where they came from, to look at their vaccination records that in Iceland. That could, I think, could be possible, but it would be a lot of work to do that for sure. This list that Sigtryggur sent to Ottawa was used to create the monument in Gimli. Some of you may have seen this monument, or maybe you're planning to visit it this weekend. And you can see up in the top left, dedicated to the memory of Thorgrimur H2, and then Christine H40. So it's the same order of as on this list, because I had sent this list to Wally Johannesson, and that was the list that was used to create the the monument in the Icelandic pioneer cemetery at Gimli. All the names are the same names that are on Sigtryggr's list from February of 1877. Um, I guess, in conclusion, to sort of wrap up this really a difficult and heavy story, I must say, is that the people who made it through this, they ultimately survived and made their homes in some cases in New Iceland, but were among those who went on to Minnesota or went to North Dakota, Argyle settlement, and elsewhere. And they overcame also the stigma that came with being quarantined during the epidemic. Um, you know, Icelanders became associated with smallpox, and people were afraid of them, that they'd get smallpox from them. And Governor General Lord Dufferin, who Jason mentioned at the beginning, in 1877 he visited Manitoba, and he visited New Iceland, and he was asked, "Well, aren't you afraid you're going to get smallpox?" And he said, "Nope." And he went to Gimli, and he made a point of going to people's houses. He walked along the road that's now 231, I think, or north. It's north of the town now, and went into each of the settlers' houses, which was part of his way of saying, these are, and he has a lot of positive things to say, of trying to counteract that stigma that had been associated with the Icelanders because of the epidemic, and to try to give them a fresh start after all the difficulties they faced in their first 2 years. So that was in at the after, about a month after the quarantine had been lifted, that Dufferin came to visit them. One last story before I close here is that the Icelanders wanted the quarantine to be lifted. They went to the quarantine line as a group to ask that it be removed, and when they got there, found it had already been removed by coincidence. That was in the summer of 1877. So I think that's all that I had to have to tell you. But I see there's some questions, and I'd be happy to answer any questions that you have. So thank you very much for your kind attention.
Thank you, Ryan. That was really great. I learned a lot. Um, just before we get into questions, I had a particular question. You had mentioned that the first year there were lack of resources. People died. 7 people died of scurvy. And then by the next year, I guess the smallpox epidemic hit, and the government poured lots of resources into quarantine. I'm wondering, was it were there more resources for the Icelanders during quarantine because they had the military there and more rations and other access to food, or was it just as bad as before?
Yeah, the government realized that by putting them in quarantine, it was also going to affect their health because they needed food, and so they approved an order in council of $25,000 to supply them over um, through the emergency. The idea was that it would be a loan that they would eventually repay, and it was apportioned out to families. And so in Iceland, in Landsbókasafn, there's ledgers that say how much each settler received and what they received specifically to see them through. In the end, that money was not repaid. Some people, when they left to North Dakota or to Dakota Territory, the John Taylor and Sigtryggur Jónsson tried to get them to pay their loan back before they left.
Mhm.
That didn't happen in most cases, and even those who stayed didn't end up paying back the loan because the government eventually decided that the Icelanders who remained were repaying the loan by assisting Icelanders who were arriving subsequently from Iceland that otherwise would have needed help because they were quite poor, whereas the established settlers were helping the newcomers get on their feet, and so we're in that way repaying the government. So they ended up saying, we're not going to bother trying to collect this debt. But
I see. Interesting. We have a question from Dawn. Did this smallpox epidemic affect Icelanders leaving for the United States?
yeah, I think it's one of the factors for, people. If you imagine you're moving to a new country, you're going to start fresh. You have all these hopes for the future. And then the first thing that happens is you're in this terrible epidemic. And, in some cases, people lost children or lost multiple children. And I think it was definitely one of the reasons why people would have thought, I'm going to go somewhere else and try a new place because it's just not working out here. Um, People had gone through this traumatic experience, and it was very, understandable that they wanted a fresh start after going through the quarantine too.
I see. Interesting. Um, One thing that struck me in reading the chapter in your book on the smallpox epidemic was the role of physicians as advisors to the government. And in my 21st century mind, going way beyond what the power we would give physicians today, like the comments they were making about whether Icelanders were going to be successful in the new world. And um, I think James, you wrote that James Lynch said that they're not equipped for the rude contest of Western pioneers. And there was also Dr. Willoughby Clark had some not so nice things to say about the the sanitary practices of the Icelanders.
Yeah.
Did that have an effect on? I mean, I imagine that created stigma, but was there any policies did they affect policies of the government or in some way affect sort of the welfare of Icelanders were negatively affected by these physicians who had these attitudes towards the immigrants?
Yeah, it was Lynch in particular who had very negative views of the Icelanders, and he was asked to write a report by the lieutenant governor, and that report it circulated in Winnipeg. So there was things in the newspapers about negative views about Icelanders, and that's got back to Ottawa, and the senior civil servant responsible for immigration asked John Taylor, we've heard all these things. Like, is this true that they don't want to don't want to work, that they live in these terrible conditions? And Taylor responded that this was all unfair and that it was a misrepresentation. And the government received that, but they also were listening to people like Lord Dufferin telling them, no, these people will be fine. They
Mhm.
are, this is not an innate character flaw in them. Um, Dufferin had his own weird ideas about race. Let's not, but
Yeah, I'm
but
not aware of those actually, but
but
yeah.
he was more positive about the Icelanders, um, and as were others that felt that this was a terrible event to happen, and it's not a reflection on them. There's David Arneson, the author from Gimli. I was watching a film interview of his where he said that the doctors mistook the Icelanders' stoicism for um, uh, for disinterest or for
Mm.
passiveness. That they didn't understand them. They couldn't really communicate with them, so they didn't speak
Mhm.
Icelandic. But uh, there was definitely a negative attitude. There was a letter by another doctor named William Augustus Baldwin, had all kinds of negative things about the Icelanders in it.
Yeah, it really struck me. We think of doctors today as being perhaps more empathetic, and these doctors were really leading the charge against immigrants to Canada. Um, Another thing about your chapter is that you spend a lot of time talking about the displacement of Indigenous people and Treaty 5 and efforts of the Canadian government to get different bands of Indians to gather representation, uh, have like one leader. They didn't want to do that. This was all happening either right before the smallpox epidemic or during it. And I wonder if you could touch on that effort, how the smallpox epidemic affected that, given that, as you put it, a whole new government was put in place that was based on the public health authority uh, for the area, and what was the final outcome there?
Yeah, it's so there there were people living in the area that became New Iceland, and they had, they had houses and they had cultivated lands. And so the question, and they wanted to claim that land as their own. And the government said that they were not willing to create a reserve there for First Nations people because it had been granted to the Icelanders. The Superintendent General of Indian Affairs explicitly told Alexander Morris, it's like, do not give them a reserve at Grassy Narrows, which is near the mouth of the White Mud River, because Icelanders proposed settling there. So the Icelanders were given preference over their claim, even though they were already there. But and they weren't going to leave. They decided that um, they were just going to stay and live alongside the Icelanders. It was the epidemic that changed that because so many of them died, and the survivors had lost so many members of their family and their friends that they decided to move elsewhere, and they were advised to do so by the government officials as well. So it changed what the possibility was that the two communities could have grown up side by side. And under Canadian law of that period in the Manitoba Act, like if a person, if a treaty Indian had land that they occupied and were farming, they had a claim to that land that had to be honored by the government. And John Ramsay later on tried to press his claim, saying, "I own this parcel of land, the river lot that became Oss in the Icelandic River settlement." He tried to claim that land for many years afterwards, but it changed everything. The epidemic changed everything. There were other possibilities, but afterwards it was became more of an Icelandic exclusive space as the government had designated it.
Not intended, yeah. That was one thing that struck me also was the lack of enforcement. So there were, the government would say, no, you can't stay. And then the Native Americans would stay, or I'm sorry, the First Peoples would stay. And then like you mentioned, the smallpox epidemic changed all that because it decimated the local population, and then there was less power to stay. One other thing, you'd written in the chapter about the missionary James Seti, who said that the Grassy Narrows was not a good place for Native peoples, but you said for unspecified reasons that they would be subject to temptations. Do you know anything more about that, or was he possibly operating in collusion with the government on that, or was he just was that his genuine opinion?
I think my suspicion is that it might be some denominational rivalry
Oh, okay.
because he was a minister of the Church of England,
Hmm.
and the people who wanted to, the Cree people from Norway House that wanted to settle at Grassy Narrows were Methodists.
Hmm.
And so it's occurred to me that the temptation that he could be talking about was actually Anglican Indigenous people converting to Methodism. That's what he might have
Oh,
been,
I see.
because
Okay.
he had his own flock and he had his own people that were communicants of the Church of England. That there had been a long history by that point of the Church of England going back to 1820 in the area. And John Ramsay himself was baptized as an adult in the church at St. Peter's, Dinaver, in the Red River settlement. Uh, so that might be what he's referring to, but I'm not 100% sure.
Okay. That's interesting. I could see that happening. If there's other questions, please put them in the chat. I have many questions, so I will continue on. But you had started off your presentation. I think it was really useful to have that map from 1812, I think it was. Um, so the Hudson's Bay Company was operating as kind of the de facto government in that area up until the Confederation of Canada about 8 years before the Icelanders came. Um, and I know that the Hudson's Bay Company provided the Icelanders with the Colville and tents. Do you know much about their relationship to the settlement? Was their idea that this would bring commerce? These were commerce-oriented Europeans that would then help their business, or what was the sort of capital markets incentive for Hudson's Bay Company to help the Icelanders?
Well, that's a great question. And the the idea with the reserves in Manitoba for immigrants, um, the was that there would be a private entity that would help backstop the costs of it. It was imagined to be like a public-private sort of
Hmm.
enterprise, because it was based on the U.S. model where the railroad got a land grant from the federal government, and then the railroad, created a colonization company or a subsidiary to actually recruit people to those lands. That was the basic idea that Canada was trying to replicate.
I
And
see.
in the case of the Icelanders, they uh, the government tried to recruit the Hudson's Bay Company to be the guarantor to the loan made to the Icelanders initially. There was a $5,000 loan when the first group came, and the Hudson's Bay Company said, "No way, we're not touching that. We're
Mhm.
not we're not becoming a guarantor to a loan. We will supply the colony and we will be handsomely paid by the federal government for doing so, but it's not our colony, it's the federal government, it's the Canadian government's colony." So they were not willing to do that, to play that role.
Interesting. Okay. We only have a couple of minutes. I guess one thing, you end your chapter of the book talking about kind of an unsung First Peoples hero of the epidemic. And most people know about John Ramsey and his story, but Joseph Monkman, you comment, might have even made a more significant contribution to helping in a crisis. And I wonder if you could just comment on what he did and his role. That would be great.
Sure, yeah. So Joseph Monkman he was of Korean English ancestry. His paternal side were Hudson's Bay Company fur traders, and his mom's side were Cree people from the Hudson's Bay, so similar to James Satie. And he lived at St. Peter's on the Red River south of New Iceland. He was with the delegation that chose the land for the Icelandic Reserve. He was their guide. And
Okay.
so he was essential in that. And then during the epidemic, he was the one who was transporting the doctors from place to place. And after the epidemic, he took in Gestur Oddleifsson and his mother and sister, whose father had died during the epidemic. They stayed at his home, and Joseph took Gestur up into the north basin of the lake and showed him, like on a fishing expedition. And so Gestur learned how to fish by traveling with Joseph Monkman and John Ramsey. And Gestur became one of the most uh, 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 prominent settlers in the Geysir district later in life. Um, and so that's the role of Joseph Monkman. He also advised other Icelanders, if you want to find fish, this is where you need to go. And eventually it was the export-oriented fishery that became New Iceland's economic lifeblood, that allowed the people there to make a living, was catching fish and selling them to companies that exported them to Chicago and New York for people who ate fish on meatless days of the calendar.
I see. So Joseph Monkman was kind of the grandfather of the Icelandic fishing industry, so to speak, and training the first Icelanders how to work the lake. Yeah,
Yeah, it's definitely one of them.
yeah, that's great. Well, thank you so much for joining us, Ryan Eyford, Associate Professor of University of Winnipeg, Department of History, author of White Settler Reserve, This has been a really important webinar for us in understanding the details of the smallpox epidemic, and we thank you.
Thank you very much.